Our passion didn't start with the mouth. It started with people, with the well-being of the profession. And if you're like me, maybe a little bit of your nerdiness and all things tech too. We all want to love what we do, but the truth is, burnout, people problems, and glass ceilings can keep us from doing what we set out to do. So let's get back to the heart of connection. Welcome to the Dental Handoff. This show is about passing you the knowledge, the habits, the systems, and the strategies to lead your teams, lean on your tech, and listen to your gut while you take care of people and truly the overall health of our communities. Let's stop using the wrong end of the toothbrush, y'all. My name is Dr. Kelly Tanner. Oh, and uniquely, I'm a dental hygienist too. You can consider me a guru in the dental and leadership industry. With over 3 decades of experience, my goal is to take you to the next level by empowering growth, perspective, and confidence. By identifying the gaps, recognizing the plaque, and extracting the truth with the other experts in the field. I'll share their stories, empower you to own yours, and elevate your passion in the process. So have a seat in the chair, put on your bib, and let's get to work. Welcome to the Dental Handoff. I am your hostess, Dr. Kelly Tanner, and today I have with me Dr. Sampada Deshpande. Sampada, thank you so much for being with us.
Yes, thank you. I'm really excited to be here, Kelly.
Yes, we met at the Denobi Awards last year. You were a Denobi Award winner, and I was so excited to talk to you. We've been trying to schedule this for a minute now, and as we were talking before we came on the show, there are just so many cool things in life that you're doing that I would love for my audience to be able to hear your insight, your lessons learned, and give some advice. But first, the question always is, why dentistry? Did you choose it or did it choose you?
That's a great question. I love how you asked, did it choose you? Well, I chose dentistry. I think I was in high school when my school counselor suggested shadowing a dentist along with other medical professionals to find out which healthcare specialty really spoke to me. Before that, I was all set on going and becoming like a pediatrician. That was like a dream for me. But my school counselor was like, hey, there's a lot of other healthcare specialties, just try out everything and see what works for you first before jumping into this big career plan. So I shadowed a bunch of professionals and I really, really liked shadowing my dentist. I liked that they had their own office, that they were, entrepreneurs in a way, managing a team, and they still had that clinical touch. They were still seeing patients, having these fun conversations with families. I also really liked how he was seeing some families for years, just for decades, like, generations of patients are coming and seeing them. That really spoke to me. And after that, it became dentistry. So here I am.
Yeah. And then so you graduated, you went out, and did you go into any type of residency?
Yes. So I actually grew up in Dubai. So after high school, I had the opportunity to go into dental school directly. That's how in the Middle East and in India, you are able to go to dental school right after grade 12.
Wow.
So so really the career, just like the decision making better be good in high school, because once you select something, you're in it for good.
That's crazy. I didn't realize that.
It is crazy, and I don't really like it because I feel like you're still very young sometimes to be able to make that big decision. Like figuring out at 16 or 17 what you want to do with the rest of your life is a pretty big decision.
Yeah.
But for those people who know what they want to do, it's fantastic. So after high school, I went to dental school in India, and dental school in India is 5 years. So I finished that, and then I came to the US to do my dental degree over here, which is a 2.5-year process. You have to apply to different schools. It's very, very, very competitive. Sit a bunch of exams, And finally you get accepted to a school, and that happened to be in Seattle. So I did dental school in Seattle, 2.5 years, graduated in 2018, and finished a GPR residency. And that was over here in Oakland, California.
Wow.
Yeah.
Okay. That's I mean, I'm just thinking about, because how old were you when you graduated high school? 17, 18?
Yes, I was 17. I was a kid. I was definitely a kid. I was 22 when I finished. Yeah, I think I was 22 when I finished dental school in India. It can be hard. There was one friend of mine I remember who super bright guy. He would always do very well in like debates and quizzes. And
Mhm.
after 5 years of dental school, he was like, you know what, I cannot do this. Like, I do not want to be a dentist. And that was a very hard conversation for him to have with his parents. I remember when he met my parents, my mom was like, really? You're not going to be a dentist? Because it was graduation day, so everyone was celebrating. But he was like, yes, auntie, I don't think I can be a dentist. Like, it's a great profession, but it's just not for me. And then he ended up going into teaching. And he is like this really successful content creator now. He makes these videos about like general knowledge, and he helps educate people who don't have resources to go to private schools. And he's doing very well, but he just changed his career because he was too young when he decided what he wanted to do.
Yeah, because I've been in education and academia for a while, and I feel like when you're taking those in America, what will happen is before you enroll into a degree seeking program is that everyone has to have the same general education courses. And I find that during that time, you do a little bit of soul seeking, you sort of lean into what it is that you're thinking that you like, and that changes. That gives you a little bit of buffer time to then choose your major. And then even with that, people will say, nah, I'm going to major in this or minor in this. And then I was talking to a gentleman this weekend. He has two masters, and his first master's was in nutrition just because he had no idea what he wanted to do. And the second one was an MBA. But it just goes to show you that even with that buffer, even when you have it, you don't know. So I'm wondering too, the career satisfaction that folks have in India. I'm just curious if you know anything about that.
You know, it's a great question. I don't have data on it, but I will tell you, a lot of people in my generation ended up becoming engineers. So there's a lot of engineering graduates, there's a lot of doctors and a lot of lawyers, because traditionally these three professions were considered they were considered safe. Like, you'll always have a job if you go into
Right.
care or you're an engineer or lawyer. So a lot of people in my generation did end up going in these professions, and we have so many engineers now who have become like successful stand-up comedians. They have gone into politics. They have gone into like business degrees. So they've gone into like a lot of non-developer based roles after having been through engineering school, which is very competitive also to get into.
Right.
So my husband, who's an engineer, he jokes that, yeah, in India you go to engineering school and then figure out what you want to do. Like, you get to live on your dream. But he's very different because he loves being a developer. So he really stuck with his goal. But it's just a funny joke.
Yeah, and then the pressure that you have to do well in high school too. That's a whole
Yeah.
different thing too.
Yes, academics is a whole other topic, but there's definitely a lot of pressure, and it's because of, I think there's a lot of reasons for that. It really, our parents, the upbringing is based on like, we want you to have a better life, and to always have a safe career, and be able to take home a good income. That is priority one.
Right.
Um, and that really drove the push towards these careers, but it's changing. I feel like the next generation will be different.
Yeah. That's amazing insight. So you went and you did your residency. Tell me what you did after you started practicing and then where you are today and how that's changed.
Yeah, so I had a slightly non-traditional path. After dental school, I was kind of done with studying for so many years, and I couldn't wait to get into the workforce. I was like, I'm going to jump in and I'm going to go into private practice and do all the big things and, finally be an adult. So I started working in private practice for a few years. Uh, about year 2 or 3, I started to get pretty burnt out. I also realized that for some reason, I felt like I was not creating value or creating an impact. And there was nothing unique about the way I was practicing compared to every other dentist on the block.
Mm.
And I also felt like I was really not contributing to the care of patients with special healthcare needs, our seniors, because I would never see them in private office. I would just never see patients who had, a long list of medical complications or anyone above the age of 70. I would very, very rarely see them in practice. So I wondered what was happening to these patients and who was seeing them.
Mm-hmm.
And my fear was that if I ever saw a patient with special healthcare needs, I wouldn't know what to do, because I wouldn't know how to deal with any medical complications that came with it, looking at their drug interactions, because it's just out of the blue. You don't see them in practice at all. So I started sharing that with some of my mentors. And one of my favorite lectures at the UW in Seattle was was a professor who taught us how to care for patients with special healthcare needs. I really, really enjoyed all of her lectures. And I spoke to her and she suggested, you know what, you need to do a residency. And she had given me that advice when I was in dental school. But at the time, it's like sometimes you get a good advice, but you're just not ready to accept it.
Yeah, it's your brain isn't open to it. You hadn't thought about it yet, right?
Your brain is not open to it. And she had given that advice to me in dental school, but I wasn't ready to take it. And then 3 years later, I was like, you are right. I need to go back and do a residency. So I ended up doing a GPR, and I worked at a trauma level 1 center where we saw the most vulnerable patients in Oakland, California. Super, super busy hospital. I think I saw everything that I needed to see in that 1 year. And the 1 year also prepared me to see patients with special healthcare needs. So after residency, I felt very fortunate that I found an opportunity where I can actually go and do mobile dentistry for patients with special healthcare needs and patients who are living in assisted living centers or at homes where they can't access a traditional dentist by leaving the home. They want to try and find services within their home. And that has just been like a game changer for me. I love doing that.
So is that your own mobile health company or do you work with another company doing that?
I work with another company. The company is called Enable Dental. I believe they have been in business since 2019, but the market that I'm working in, which is just East Bay in California, that is relatively new. So they
Gotcha.
only recently opened up their office in California. And it's great because they will provide you with all of the equipment we need. They provide us with assistants, and my assistants are amazing. They're super motivated, so hardworking. I still don't know how they carry all of the equipment because Aseptico and all of our mobile equipment can be very heavy. um, yeah, and they set everything up, and it's good to go. We are able to extract teeth, take denture impressions, hygiene, do whatever the patient needs. And it's been a great service so far.
So what type of facilities do you all care for?
I would say 90% of the time it's assisted living centers. So we're going to different assisted living centers all over the Bay Area and the East Bay. 10% of the time we're going to patients' homes, and then we're setting up equipment around their bed or a wheelchair, wherever they are, and providing services to them there.
Wow. Was that a huge learning curve for you going from a private practice setting into a mobile dentistry setting? Like, what did you have to unthink or rethink going into that change up? That's huge.
Yes, it is. It is very, very different. Initially, it was difficult because number one is we are traveling to all of these patients' homes, so there's definitely a commuting factor. You're on the road quite a lot. But the other thing is sometimes patients are in a wheelchair and it's not going to tilt very far back, or you can't have the patient move up and down, like how they are on a traditional dental chair. So I've had experiences where I have literally I sat on the floor and I extracted patients' teeth because there was just no better way for me to do it because of alignment. I think the most important thing, however, is to get a really good pair of loops. So I use ergonomic loops. So my back and my posture stays fairly stable, given the circumstances. And ultimately, I think we should all remember when we're going into these situations is that we are the last resort for our patients. If there's something you can't do, we should try to really think in terms of, okay, if I can't do it, is there anybody else who can come to this patient's home and do it for them? Because referring them out is not going to work. Most of them are not going to be able to get to a dental clinic. It's too inconvenient, sometimes too expensive for them to get out of the assisted living facility and make their
Wow.
way to a dental clinic. So there's all of these little factors that come into play. But Kelly, I've had a few mentors who have done this work before and have provided me with a lot of advice. And it's really fun. Our patients are so sweet and they're so nice. They really appreciate seeing the dentist because they know that their circumstances are such that it's hard. So they're full of love and full of care. So it's been a great experience for me.
What was I'm gonna put you on the spot a little bit here, but what was some of the best advice that you received from your mentors?
I think the first thing that I will reiterate again is that you are the last resort.
Mm,
So really treatment plan comprehensively. Think about, okay, what can you do to improve this patient's quality of life? Um, if it's dentures, if it's extracting bad teeth, or maybe it's silver diamine fluoride, think
mhm,
about what can you do, and always come up with two plans. So there's a good plan and then there's a better plan.
mm,
So we have to remember that not everyone has the financial resources that we think they do. Some of them are on limited income. Some of them have very, very limited insurance. So come up with two plans and let the patient make the decision.
right.
Another advice I received was that what you think is possible in a traditional dental clinic is sometimes not possible in a mobile or like a portable setting. So, for example, how we take impressions with alginate, I can't do that because there's nowhere to pour the alginate. So I have to work with heavy
Oh, yeah.
body, which is very tricky. We're not always used to using heavy body, except if it's a crown, right? But in our case, we have to use heavy body for impressions, and the impression better be perfect because again, it's not like the lab. It's not like you can have the patient come back in 2 days and take another, set of impressions. You would have to make that long trip and go back to their home, and that's not
Right.
always possible because you have lots of other patients who need care. So whatever you do, make it count, and think in terms of the patient's age. Look at their medical history. Ooh, last piece of advice, very, very important. Um, Patients end up seeing their dentist more often than a typical physician. We already know this. There's lots of
Right.
statistics that prove that. And a lot of us actually don't have the habit. We don't make it a habit to look at the medical history at every visit. And there are so many things that a dentist can alert the rest of the care team about
Yes.
regarding a specific patient. So, for example, uh, there was one patient that I saw really, really poor oral health, extremely poor oral health. You could tell right away that there's something going on. And then we asked her about her diabetes. Her blood sugar has been above 300 for the last few months. And she's on a very, very low dose of insulin. So it's like, okay, why is her dose of insulin so low? It needs to be higher because having consistently high blood sugar is not good for her. So a simple call to the endocrinologist can help. At least you can find out what their game plan is. And for me, I simply told them that, you know what, we need to take her teeth out because if we leave them in, they could get infected. It could be a bigger problem. And she's not able to eat anything. That is like a fundamental thing that she needs to be able to do. Like she should be able to eat. And she's not able to because of her teeth. So she was like, okay, fine, we will increase the insulin dosage. We will try to get it at least in the 200s, her blood sugar. And then you should be able to take her teeth out and hopefully she gets stabilized. So a dentist can do so much. Our dental care team can do so much. And we really can help patients get stabilized better. So
Yeah.
we should take that responsibility seriously.
I agree with that.
Yeah.
I think there's such a huge well, there's so many huge opportunities in that time that we spend with them because even though they see us more often, it's really not as often as some should, because of access issues or the things in life that keep them from coming to us. So in that time that they have with us, it's important to make it count, to your
Yeah.
point, to make sure that they're understanding how their oral condition impacts their body and their organs and their
Yes.
life and inflammation and what that means for everything.
Everything is interconnected, which is why I love that there's a lot of groups, a lot of dental practices that are now starting to focus on the medical dental connection, and
Mhm.
they're starting to implement practice management softwares like Epic so that you can see the medical history of the patient. And it's not as hard to reach out to physicians. It's like a simple, secure message to the endocrinologist or to a psychiatrist and ask them, oh, how's this patient doing? Are they stable? Can I proceed with my treatment? What do you think?
Right.
So if technology makes it kind of easy to connect with all of these people, then providers will not feel as burnt out and they will be more able to like care better for the patient.
I agree. I
Yeah.
totally agree. It's you you and I see this things the same way. Now, you were also telling me too, which I already knew about, that you have developed a cutting edge technology that helps practices help with insurance verification. Tell our audience more about that because it's amazing.
Yes. So a few years ago, I started a study club called the New Dentist Business Club, which only focused on the business side of dentistry. And the reason for this was because I noticed that most of our CE is heavily entrenched into the clinical side, but we don't get a lot of education on the business side, especially when we are in dental school. And so in this club, I had the opportunity to meet a lot of practice owners or some of my friends who became practice owners. And one of the biggest concerns they always have is insurance and how we can improve our relationship as providers with insurance, because insurance is here to stay. It's not really going anywhere.
Mhm.
Patients do get a lot of benefits out of it, so they will continue to use it. Um, but I really wanted to see if technology, in some way or form, can help this can help kind of clean up this insurance piece of the puzzle. So we spent all of last year prototyping and beta testing a product that would help automate at least the first part of insurance, which is just figuring out what are the comprehensive benefits that Kelly has from her insurance plan. Will this implant get covered? Will a bone graft get covered? Little things like that, which typically require a phone call or sometimes require a front office administrator to log on to lots of different insurance portals at the same time. So all of these tasks, we wanted to see if it could be automated so that the insurance coordinator doesn't have to do those kinds of things.
Yeah.
And do better things with their time. And we were able to beta test it with a couple of different offices here in the Silicon Valley. And we launched the product in January of this year. I'm very proud of how far it has come. I would have never expected it to be such a success today because I was expecting it to be slow growing for the first year. But basically, we've had a lot of internal marketing, just one group of dentists telling another group of dentists at like a dental society meeting or a conference, and it's just been growing that way. So we're very lucky. Our customers are very, very good, and they give us a lot of feedback. It helps us improve the product. So it's only up from here on. We have a lot of work to do. I think the dental industry it has a lot of opportunity for technology automation. And in general, there's a lot of opportunity to improve the way we practice. So I just like to keep my eyes open and be curious about what's out there.
Yeah, you're solving a huge problem for a lot of folks. Then we know with workforce shortages, it's not just one, it's just not dentistry, it's everyone. And for that human resource that is it's kind of required to have that in the practice, because otherwise patients leave, they get upset when you can't communicate what they have, because they do have that expectation. Not that we're providing dentistry based on the insurance coverage, but to help them understand what their insurance covers and what they don't, and help them understand how we can provide payment options beyond that, if that's something that they're interested in as well. But that's a huge lift it takes off the front office administrators.
Yeah, it does. And we were talking about it earlier, but I'm a firm believer of everyone to function at the top 10% of their capacity. And we are capable of so much more than we spend our days usually.
Yeah.
And logging into different insurance portals, printing out benefits of patients and putting that back into the practice management system. It's just an old way of doing things, and we shouldn't have to do that anymore because technology is here. We are capable of doing better things, and there's lots of things that only humans can do and technology cannot. So we should really focus on that.
Totally agree. And that's not fun. It's not fun for anyone to sit there and click through sites and call people and stay on hold for 45 minutes.
It's super boring, it's tedious, and it creates a lot of burnout. It's emotionally draining to be on the phone. Nobody wants to be on hold.
No, it's crazy. What's the name of your platform?
It's called SamsoSmile. SAMSO Smile.
Okay, cool.
Yeah.
And we'll have that in your show notes as well. For our audience, we always put all the information. We'll also include your website and your contact information so folks can reach out to you. It has been such a delight to have you on the show today. Is there anything else that you want to share with the audience, that things that we didn't talk about that you want to tell anyone?
Not really. I think I just want to share that something that my dad always mentions to me is, think about the bigger picture. Even if you're a hygienist, dental assistant, dentist, when you're taking care of your patient, think about the bigger picture. How is this patient going to get better? What can get them to function at their top capacity, live their highest quality of life. And same thing comes with like products that you use or how you live your life or see the dental profession. There are ways in which we can make our profession better, and we should constantly be striving towards that. So, instead of looking at the nitty gritty all the time, try to look at the bigger picture, be curious and innovate.
Absolutely. Innovate. Yes. Because it's not I'm a dental hygienist, but I meet all types of providers where it seems like it's a transaction for them. And it's just it breaks my heart because it doesn't need to be that way. We have so much to be excited about and passionate about in the profession of dentistry and what we can do to help people.
Yes, absolutely.
Well, thank you so much for being on today. It's so nice to spend time with you. Keep doing all the great work that you're doing, and you all please reach out to her. Her contact information's in the show notes. And for all of my listeners, if you wouldn't mind doing me a favor, I always ask is to go on to Apple, give me a 5-star rating, 5 stars, because Apple's the one that matters for all the AI stuff. And then go on over to YouTube, like, share, subscribe, and then share it with somebody else who you really love that would love this episode or any of the other episodes on the Dental Handoff. So thank you again for being here. Thank you everyone for what you're doing for the communities you serve. Thank you for your great work. Till next time, thank you so much for being on.
Thank you, Kelly. Thank you so much.
Bye-bye, everyone.